So the global COVID-19 infection rate has hit more than 20 million confirmed cases, with the death toll reaching 750,000 in South Africa. There have been new cases, taking the total reported number to 579,140 deaths. Those have gone beyond the 11,200 mark. President Cyril Ramaphosa will address the nation later on this evening at 8 p.m. amid speculation that the move will remove the prohibitions on the sale of tobacco and alcohol. However, experts have said that whatever the easing entails, it's important that restrictions on gatherings remain in place, as well as the mandatory use of masks and other social compacts. Co-operative Governance Minister Nkosazana Dlamini Zuma has extended the national state of disaster for another month. The decision has been published in the government gazette. Joining us now, political economist and senior research fellow at the Trade Collective, Ms. Lebohang Pheko, as well as political analyst Professor Somadoda Fikeni. A very good evening to you both, and thank you so much for joining us. Let me start by asking you a question that we're asking our viewers. Ms. Pheko, I'll start with you. The question we're asking our viewers is whether or not whoever you are at home in this country, believe that we are ready to go a level down on the risk-adjusted alert levels. What are your thoughts on this?
There's several thoughts. I think the one is that the peak of the infection rate has probably bulged out, and that we're hoping that the worst is over. Secondly, that in terms of economic sustainability, there's probably a feeling that the economy has reached its saturation rate in this regard. And thirdly, that we're actually in de facto a level beyond what we seem to be. We seem to be in a masked level 1 or level 2 at the moment, because essentially the economy is moving. There is a very slow and hesitant recovery, but one nonetheless. And also bearing in mind that the infection rates have been reducing quite significantly. And we're hoping that this means that the very delicate balancing act between saving the economy and saving human lives, personally, I think that we should be focusing on the latter, has hopefully been met. And I think lastly to say that in all of this, we need to make sure that the opportunity to think about structural change and really fundamental social infrastructure is one that can be focused on going forward, because many of these conversations and the traumas that have taken place would not be taking place if the basics were in order, with schools, roads, infrastructure, electricity, water, sanitation. All of these things were brought to bear during this time, and they will continue to be a huge priority going forward.
Professor Fikeni, what are your thoughts?
Well, I do think that we shouldn't expect the overall lifting of any restrictions, precisely because you just had the World Health Organization experts coming to the country. So they would still like to see some restrictions and some intensified effort to contain what could possibly be a second spike if it is not controlled. But at the same time, we do know for a fact that economic pressures of livelihood, which are also exacerbated by the fact that the state capacity to even implement what they had promised as intervention measures have not been actually effective. So they would rather have the economy opened and more relaxed in a way, and during that period, the pressure would be removed from them. And the last part, of course, the shift now is towards economic recovery, as Lebohang was saying. And that in itself, and demands for structural changes or even a social compact, is going to be the main thing that dominates the country going forward. The fight against corruption will still be a dominant feature as well.
Speaking about that social compact, Ms. Pheko, we clearly need development policies that are geared to disproportionately benefit the poor and accrue. And we're hearing about this mass employment plan, that this is being touted as one of the possible announcements by the president. To your mind, what would be the best way of rolling this out, and what would it look like?
Hard to tell. I mean, I think as Somadoda has already said, the kind of the state infrastructure and its capacity to support and to provide a buttress for the economic trauma that has taken place and is still taking place for small businesses and for households has been extremely limited, not aided and abetted, of course, by the existing fragilities in conveying social grants in a timely manner, some of the controversies around SASA and so forth. I do think that there are a few things that we should think about. The one is that one of the few reasons that people were very alarmed about the notion of staying away from work is the possibility of potentially starving to death, literally. And we need to really think about food price controls in this regard. The second piece of this is that some of the restrictions that have been taking place, especially the spatial geographic biases that really have penalized Black people, African people more during the coronavirus. So the ability to move from one place to the other, the exceeding, the almost impossibility for subsidized transport, affordable transport, and the taxi ranks, the taxi services, which have been really the monopoly way in which people get from one place to the other, have not always been compliant at all with COVID and corona health regulations. So secondly, we need to think about, different social and transport infrastructure. And I think that also bearing in mind that the capacity to convey social grants has not been very effective at all. Are there different ways to rebuild and to reconstruct the social compact? So whether we can think about mechanisms that are beyond cash transfers. Cash is very important, I don't disagree, but I think that we also need to think about different forms of rent subsidies, bond subsidies, for example, different ways in ensuring that food is the food prices can be bought not only with cash, but also cashless forms of providing subsidies to different communities, and especially indigent and marginalized, economically marginalized and dispossessed communities. And I think that moving forward from that, the ways, SMMEs in this country have taken an absolute beating during this time, bearing in mind that the economy has been in a state of truncation for at least 24 months, and certainly in the last 4 quarters, even before Corona and COVID-19 hit and beat them up even more. We really need to think about ways in which the state can provide direct and indirect support, capital support, recapitalization support, to ensure that small businesses are able to recover. And because those are exactly where most of the growth takes place. That's exactly where most of the labor is absorbed. 65% of labor absorption takes place through the SMMEs. And I think that the neglect of SMMEs over this period, the past 100 days, is quite an appalling indictment on the state, actually. I think we should really avoid a situation where, once again, large businesses, large corporations are being bailed out, as in 2008, and smaller households, smaller communities, and smaller businesses are completely marginalized. I think one of the saddest things I've seen over the last few weeks is business after business that have been in operation for 10, 20, 30 years, hearing the headlines that this and that restaurant has gone under, or even knowing friends that I know, personally, who are either struggling or have had to close shop. And this is really not sustainable.
Professor Fikeni, what are your thoughts on this, especially if we're being told that government would want to encourage some anti-retrenchment measures for many businesses that are already going down and which have been hard hit by the coronavirus? For instance, the tobacco and the alcohol industries are saying even if the ban were to be lifted, for instance, the billions of rands that they've lost will make it very hard for them to recover. So how will government, at least encourage business to embark on these anti-retrenchment schemes, mass employment schemes?
Well, I do think that can go to a certain extent, but it will not solve the entire problem. We need to overhaul the entire economic system and use this crisis as an opportunity to have courage to do things we have not done. For example, one of those things, if you're paying beyond 200 billion for social grants, how do you make that money circulate within communities before it goes back to the dominant, economic players? And you also have the focus, I agree entirely with what Lebohang is saying, our obsession with foreign direct investments and our obsession with the big corporates is such that those are capital intensive, and yet your small, medium businesses are very much labor intensive. Precisely the point you want to deal with the issue of unemployment and poverty as well as growth. Most countries that grow, they grow on the back of those small, medium businesses being supported instead of simply focusing on the bigger ones. In any event, with the current global economic crisis, which will change the global system, it is unlikely that you're going to have companies, big ones, which are also distressed in their own base, rushing at the time of this economic nationalism to other countries to invest. So looking internally, whilst transforming, while dealing with the structural issues that we've always avoided, that in itself to me is key. Rural development, township economies are some of the areas of major focus. Internal tourism, it's yet another area that we should be looking at.
Ms. Pheko, you mentioned earlier on the inequalities that have seen themselves grow, especially through the various rescue packages which have not reached the people that it was intended for. Just looking at what the president has to do to get us out of this quagmire, there are some who suggested that perhaps raise the incomes of the poor through the markets or through fiscal measures. Is that something that would receive political support, do you think?
Very good question. I mean, the sad thing is that there are a whole bunch of different solutions and different suggestions that are available to us, and exactly, increasing corporate tax, for example, for sectors like agriculture and retail, which hire higher proportions of people and which actually have been the most vibrant over the last 100 days or 120 days or so. Thinking around the ways in which, for example, we could suspend benefits of tax cuts for corporations and high earners, which usually bypass indigent communities and working class or non-working class communities. And these are the communities which disproportionately, by the way, experience regressive VAT and consumption taxes. We could also look at, for example, the ways in which the Reserve Bank, which, by the way, has foreign exchange reserves worth 800 billion rands, could fund a basic income for a bit longer than the 6-month window period which we were given when the economic stimulus package, the COVID economic stimulus package, was announced. But as you ask a pertinent question, is there the political appetite for this? And I think if we were really thinking in a war room mentality, that this was a non-partisan issue, that COVID-19 is not per se a party political issue, but it is a national issue. And I think, it's this whole notion of a national state of emergency. The world is at war. Let us put aside our differences in order to make this happen. Then I think that we would be getting a different sort of sense from the opposition party, that we need a different opposition movement of corralling behind this plan of action. That was apparent over the first 10 or 20 days of it, of the lockdown. But I think that goodwill has regrettably, in my opinion, dissipated and degenerated into the usual party political point scoring, with different accusations being made rather unfairly in this instance, that the government and the state have waited too long to reopen the economy, and that this has cost, that the economy has, this has cost our country an irreversible, retrogressive economic loss. I don't think that it's irreversible, but I do certainly tend to agree that it has shown its existing fragilities. So yes, it's difficult to know how this is going to land, because almost without exception, nearly all of the political parties have in different ways used this situation, which really frankly is a force majeure. It's really an act of goodness knows who could have predicted this, for their point scoring and Twitter scoring and so forth, in ways that I think really show I think a lack of political foresight and somewhat a lack of constructive patriotism in a very difficult time.
Professor Fikeni, I believe we're just obviously about 5 minutes away from the president speaking, and I believe that he's getting ready to do so. And I want you to reflect on the week that he's had, the meetings he's had with the National Command Council, and the kind of information that they would have given him, especially statistically on how South Africa is doing with regards to COVID-19. But especially Labour, I believe that there was a very tense discussion there. Labour saying to the president he better get his, act together, and he needs to reopen the economy once again. So he'll have to do that in a manner that is responsible, but can he please everyone?
In fact, I do think that the failure of decisive leadership at times, it's when you try to make everybody love you and try to please everybody. You should aim to be respected by a person because of the force of logic, of the vision you have that rally people around, that bring in all stakeholders, but trying to please everybody, even at times when there are contradictions in what you're trying to put in place, that in itself is not an ideal situation, especially during crisis. What we are faced now is unprecedented in scale and scope. And it is something that we should be looking at instances of Great Depression in the US when Roosevelt rallied the nation with the New Deal, or even the post-World War when we had a Marshall Plan. The crisis that we have simply exposed and amplified the weaknesses and things we have not attended to all over. Yes, indeed, it is important to get the stakeholders on board. It is important to get everybody at least understand and respect why certain decisions are taken. But there ought to be decisiveness in the step that it takes, especially with economic recovery.
Ms. Pheko, the readiness of the health system, that has been a major stickler point for why decisions are taken in the manner that they've been taken. It's been said that there is a possibility of a second wave. Political opposition parties are saying it's highly unlikely, yet we have the head of the Advisory Council of COVID-19 saying that the models that we have been working on haven't quite panned out the way we have. We were talking about the European experience and America, for instance, in trying to ease lockdown to stimulate their economies, but they've also pumped a lot more money into their economies as well. So how are we going to navigate the space in saying ultimately we are ready?
I think it's, initially, again, so much is different on the ground than what was anticipated. And I think 100 days or 120 days is a very long time ago. So initially, we had the impression in this country, or we were given the impression by some of the people in the scientific and the medical community that we had the assessment mechanisms and the modeling mechanisms to predict to a great extent what the impact of the onslaught of COVID-19 would be in this country. And that even though we would not be spared, we had the infrastructure, the medical infrastructure and the scientific and research infrastructure to be able to in some way abet and assuage the worst of it. I don't know if it's a combination of carelessness or just perhaps some complacency, but somehow a lot of that expertise seems to have been squandered. And we see the numbers that we have right now.
Ms. Pheko, thank you very much, Ms. Lebohang Pheko and Professor Somadoda Fikeni.